Hi everyone, welcome to Canadian Nurse Expert. You know, as a nurse, I see a lot of skin conditions every day, and sometimes those conditions can be a real pain, literally. But what's really rewarding is helping my patients understand what's going on with their skin and how to manage it. And that's what we're all about here, giving you the knowledge and tools you need to be confident in your nursing practice. Today, we're diving deep into the world of multiple sclerosis. We're gonna tackle some seriously tough NCLEX style questions, the kind that make you really think. But don't worry, we're not just gonna throw questions at you and leave you hanging. We're gonna break down the rationale step by step so you really understand the why behind the what. Let's get started. Okay, let's start with the nitty-gritty pathophysiology. Think of multiple sclerosis like this. Imagine your nerves are like those really cool fiber optic cables that bring super high-speed internet to your house. They're all wrapped up in this protective coating called myelin. Now in MS, the body's own immune system gets confused and starts attacking this myelin, like it's some kind of unwanted invader. This attack causes inflammation and damage to the myelin sheath, leaving those nerve fibers exposed and vulnerable. It's like if someone started stripping away the protective coating on those fiber optic cables. What happens? The signals get all messed up, right? They can't travel as fast or as smoothly as they should. That's what happens in MS. Those nerve impulses get slowed down or even blocked completely, leading to all sorts of problems. Now, Mississippi is a real trickster because it affects everyone differently. It's not a one-size-fits-all kind of disease. One important distinction to understand is the different courses MS can take. One type is called primary progressive MS. Imagine a steady decline, like a slow leak in a tire. That's what primary progressive MS is like. From the very beginning, neurological function gradually gets worse, without those clear periods of relapse and remission that we see in other forms of MS. It's like the brakes are constantly being applied, making it harder and harder to move forward. And unfortunately, this form of MS often progresses more quickly and can be more disabling in its early stages compared to other types. It's important to remember that each person's MS journey is unique, just like each person's skin is unique. When it comes to managing MS exacerbations, those flare-ups that can really knock you down, high-dose corticosteroids like methylprednisolone are often the go-to treatment. They work by calming down that overactive immune response that's causing all the trouble. But here's the thing about these medications. They're powerful, and with great power comes great responsibility, right? You see, corticosteroids can have some pretty significant side effects, especially when given in high doses and intravenously. That's why it's super important to keep a close eye on things like blood pressure and blood glucose levels. Corticosteroids can make your body hold on to water, which can lead to high blood pressure. They can also mess with your blood sugar, causing it to spike. So monitoring is key. Chapter 4. Complication Prevention. Now, let's talk about prevention. One of the biggest challenges for people with progressive MS, especially those with limited mobility, is preventing complications. Think about it. If you're not moving around as much, things can get stagnant. That's why it's so important to keep those joints moving and those muscles from getting stiff. Passive range of motion exercises are like giving those limbs a helping hand, literally. It's like gently stretching and bending the arms and legs to maintain flexibility. And don't forget about repositioning. Imagine sitting in the same position for hours on end. Not very comfortable, right? Well, for someone who is bedridden, it's not just about comfort, it's about preventing pressure ulcers. These sores can develop when there's constant pressure on one area of the skin, cutting off blood flow. So regular repositioning is crucial. Chapter 5. Symptom Management. Fatigue. That overwhelming feeling of exhaustion is a common and often debilitating symptom of MS. It's like your battery is constantly drained, no matter how much sleep you get. And to make matters worse, heat can be a major trigger for fatigue in MS. Think about it. When you get overheated, you just feel sluggish, right? Well, for someone with MS, heat can amplify those feelings of fatigue big time. That's because heat messes with nerve conduction, especially in those demyelinated nerves. So, the best advice you can give someone with MS who struggles with fatigue is to avoid heat like the plague. That means staying indoors during the hottest part of the day, keeping cool with fans and air conditioning, and even taking cool showers or baths. Chapter 6: Psychosocial Impact. Living with a chronic illness like MS can take a real toll on a person's emotional well-being. It's like carrying around this invisible weight that affects every aspect of your life. So, it's completely normal for someone with MS to experience a wide range of emotions, from sadness and grief to anger and frustration. As nurses, we need to be prepared to provide not just physical care, but emotional support as well. Sometimes, the most important thing you can do is simply be present, listen with empathy, and let your patients know that their feelings are valid. It's like when you get a really bad breakout. Sometimes you just need someone to listen and say, "Hey, I get it. That really sucks." Multiple sclerosis can affect not just the nerves that control our movements and sensations, but also those that regulate our internal organs. You know, the ones that keep things running behind the scenes. This can lead to all sorts of problems, including bladder dysfunction. Now, one type of bladder dysfunction that's common in multiple sclerosis is called a flaccid bladder. Imagine a balloon that's lost its elasticity and just kind of hangs there. That's what happens to the bladder in this case. The muscles that control bladder emptying become weak and flaccid, so the bladder can't contract effectively to expel urine. This can lead to urinary retention, where the bladder doesn't empty completely, and overflow incontinence, which is exactly what it sounds like. Urine leaking out because the bladder is constantly full. When it comes to setting goals for our patients with MS, we always want to keep them patient-centered. That means involving the patient in every step of the process and making sure the goals are meaningful to them. For someone with MS who is experiencing ataxia, that lack of coordination that can make even simple movements a challenge, and frequent falls, a really important goal would be to prevent those falls from happening in the first place. And a great way to do that is by encouraging the use of assistive devices, like walkers or canes. These devices can provide that extra support and stability that someone with ataxia needs to move around safely and confidently. Managing MS requires a true team effort, and that means collaborating with other healthcare professionals. It's like a well-coordinated dance, with everyone playing their part to provide the best possible care for the patient. For example, if a patient with MS starts having trouble swallowing, a condition called dysphagia, our first call would be to a speech-language pathologist. These specialists are experts in all things swallowing, and they can assess the patient's swallowing function, identify any underlying problems, and recommend strategies to make swallowing safer and easier. There are a lot of different medications used to manage MS, and each one works in a slightly different way. One class of drugs that's often used is called disease-modifying therapies, or DMTs. These medications work by suppressing the immune system, calming down that overactive immune response that's attacking the myelin. One example of a DMT is interferon beta-1a. It's like a peacekeeping force that helps to reduce inflammation and prevent further damage to the nervous system. Now, it's important to remember that DMTs don't cure MS. They're more like a maintenance plan, helping to slow down the progression of the disease and reduce the frequency and severity of relapses. So, there you have it, a crash course in mastering those challenging MS NCLEX questions. Remember, just like with any skin condition, knowledge is power. The more you understand about MS, the better equipped you'll be to provide top-notch care to your patients. And trust me, I know it can feel overwhelming at times, but you got this. Just remember to break things down step by step, focus on those rationales, and don't be afraid to ask for help when you need it. We're all in this together, just like a big supportive community. Now go out there and ace those exams.